What if I told you there's a molecule that doesn't just act like an antioxidant, but actually helps your body build its most powerful antioxidant from the inside out? Wouldn't that be cool? A molecule that has been studied in brain health, addiction, fertility, kidney protection, and neurodegeneration, and even used clinically to save lives in cases of toxicity. That molecule is N-Acetylcysteine, or NAC. Welcome back to Molecules Matter with Dr. Dan, where we take the most important molecules from science and break them down into what they actually do inside your body so you can understand how to use them to improve your health. Because remember, new molecules equals new signals, equals new cellular outcomes, equals a new you. N-acetylcysteine is a modified version of the amino acid cysteine. Chemically speaking, it's cysteine with an acetyl group attached, which gives it two major advantages. Number one, it becomes more stable, and number two, it becomes more bioavailable. But the real reason NAC matters isn't because of what it is, it's because of what it becomes. NAC is a precursor to glutathione, and glutathione is one of the most important molecules in your entire body. Glutathione is often referred to as the master antioxidant, the cellular detoxifier, and the guardian of your mitochondria. It plays a role in neutralizing free radicals, detoxifying harmful compounds, protecting DNA, and supporting immune function. But here's the catch. Your body has to make glutathione, and one of the limiting factors in that process is cysteine availability. That's where NAC comes in. NAC itself is not commonly found in food. However, cysteine, the amino acid it's derived from, is found in eggs, poultry, dairy, garlic, and onions. But under conditions like stress, illness, inflammation, and aging, your body may not produce enough glutathione. So NAC becomes a way to bypass that bottleneck and directly support your internal antioxidant system. Let's go back to the body as a city analogy. Your body can be thought of as a city. Cells are buildings, DNA is a blueprint, mitochondria are power plants. Now imagine pollution is oxidative stress, fires is inflammation, and waste accumulation is toxins. NAC plays three major roles in this city. Number one, it rebuilds your antioxidant defense system. NAC provides cysteine, which allows your body to produce more glutathione. And this helps to neutralize oxidative stress, repair damaged cells, and protect mitochondria. This is foundational. This isn't just symptom level. This is system level. Number two, NAC regulates oxidative stress and inflammation. Oxidative stress is one of the main drivers of aging, chronic disease, and neurodegeneration. NAC helps restore redox balance, which is the equilibrium between damage and repair. And when that balance is restored, inflammation often comes down as well. Number three, it influences neurotransmitter systems. NAC has a unique ability to regulate glutamate, which is one of the most important neurotransmitters in the brain. Glutamate is essential for learning, memory, and brain signaling. But when dysregulated, it can contribute to addiction, psychiatric disorders, and neurodegeneration. NAC helps normalize this system. One of the most exciting areas of NAC research is in the brain, specifically in traumatic brain injury and concussion. Let's talk about that first. Studies have shown that NAC can improve cognitive symptoms, brain connectivity, and recovery after injury. For example, research published in the Journal of Head Trauma Rehabilitation demonstrated improvements in brain function and symptom profiles in patients with post-concussion syndrome when treated with NAC. Earlier studies also showed benefits in military personnel with blast-induced brain injury. Mechanistically, this makes sense because NAC reduces oxidative damage, it supports neuronal repair, and it enhances mitochondrial function. Let's now talk about Parkinson's disease. NAC has been shown to influence dopaminergic systems, which are central to Parkinson's disease. A clinical study found that NAC improved dopamine transporter binding and overall neurological function. This suggests NAC may protect neurons, improve neurotransmission, and slow functional decline. NAC has also shown good research in the area of schizophrenia and early psychosis, and multiple studies have explored NAC as an adjunct therapy. Findings include improved symptoms, enhanced functional connectivity in the brain, and better cognitive outcomes. And there aren't a lot of natural resources or natural solutions to help with schizophrenia. So this is a big deal. Great research in the area of NAC. And again, when it comes to NAC and schizophrenia and psychosis, this ties back to glutathione restoration, oxidative stress reduction, and glutamate regulation. Let's talk about NAC and addiction and behavioral regulation. NAC's ability to regulate glutamate makes it perfectly interesting in addiction. Studies have shown that NAC can help with reduced alcohol cravings, changes in brain response to alcohol cues, and potential benefits in gambling behavior. What's happening here? Well, NAC helps normalize the brain's reward system. Instead of overstimulation and dysregulation, it brings this reward system back into balance. And that's why we're seeing really good, powerful results in this area of addiction. Let's now talk about metabolic and hormonal health. NAC has also been studied in metabolic conditions like polycystic ovarian syndrome, or PCOS. In women with PCOS, NAC has been shown to improve insulin sensitivity, support ovulation, and improve hormonal balance. It can also help with male fertility. In men, NAC has been shown to improve sperm quality, reduce oxidative stress, and improve DNA integrity. This highlights a key theme. Oxidative stress affects fertility, and NAC helps correct it. Kidney protection. NAC has been widely studied for its protective effect on the kidneys. Clinical trials show that NAC can reduce risk of acute kidney injury and improve renal function after surgery. This is particularly important in surgical settings and high oxidative stress conditions, and just living in general, because lifestyle factors are always pressing down on the kidneys and want to damage kidney function, and NAC is a good way to fight back against that. Inflammation and immune support. NAC has anti-inflammatory effects that have been studied in conditions like rheumatoid arthritis. And this research shows reductions in inflammatory biomarkers and oxidative stress markers. So if you have rheumatoid arthritis or another autoimmune condition where inflammation is a big deal, NAC could help. And again, the mechanism comes back to restoring redox balance. Hearing protection. Now here's an interesting one. NAC has also been studied in protecting against noise-induced hearing loss. So, like riding that motorcycle, going to a concert. Studies in workers exposed to loud environments showed reduced hearing damage and protection of inner ear cells. And when you protect against noise-induced hearing loss, you also help to protect against tinnitus or tinnitus. What NAC does not seem to do well? This is an important clarification because we want to stay grounded in the data. For example, NAC has not consistently improved endurance performance in trained athletes. And some psychiatric conditions, like bipolar or even OCD, has shown mixed or limited results. Now, when it comes to NAC and OCD, there's a lot of anecdotal evidence showing that NAC can help with OCD. And if it does for you or a loved one, that's great. But when it comes to the peer-reviewed scientific literature, these large controlled studies, NAC and OCD doesn't reach the level of significance compared to a placebo. So this highlights an important principle. NAC is powerful, but it's not universal. Let's talk about clinical use. One of the most well-studied uses of NAC is acetaminophen toxicity. In hospital settings, NAC is used to prevent liver failure, replenish glutathione rapidly, and save lives. This is one of the clearest examples of a molecule directly restoring a critical biochemical system. Based on the scientific literature, a common and effective dosage is 600 milligrams of NAC twice daily. This provides sustained support for glutathione production and consistent antioxidant activity. And as always, if you have a medical condition or are taking medications, you should consult with your healthcare provider before starting NAC. So in closing, NAC is not a flashy molecule. It doesn't give you a quick hit of energy. It doesn't act like a stimulant. But what it does is far more profound. It helps your body rebuild its internal defense systems, restore balance, and protect itself from the inside out. And that's what real health is. If you enjoyed this episode, click the Yes No References link on my website, drdangoobler.com, to see the scientific references. Follow this podcast for more episodes, and share this with someone who wants to understand how molecules actually shape their health. Because at the end of the day, molecules matter. And now you know why NAC might matter for you. This is Dr. Dan, and see you next time.